So that's my name, Kashif Rizvi. And as Dr. Kamran kindly pointed out, I trained in the UK. I'm also a professor with 2 different universities in an honorary capacity. I teach the undergraduate students from the University of Belfast. I'm also the head of the Department of Endocrinology and Diabetes in a hospital in the UK. And I have also a medical center in Kuwait, as Dr. Kamran pointed out. Does anybody know what this is?
Ancient Egyptian inscription.
So this guy already knows. So we have to watch him, right? So please, next press if you don't mind. Basically, diabetes is not a new disease, but it's a very strange thing which has happened in the world of diabetes. As you can see here, that 1500 years before Christ, so that is a long way away, right? The Egyptians were kind of writing a Lancet or New England Journal or New Cairo Journal of Medicine at that time. So this paper, discovered and restored, describes a condition with frequent urination and weight loss, right? Which we all, or most of us, believe that diabetes is. And its name was given to them via Greeks as diabetes, which means siphon or leakage. And mellitus means honey, right? So somebody they thought was leaking honey, and hence they had to go to the loo a lot and they lost a lot of weight, right? Clear? Now, diabetes mellitus, we still call it. And why do we keep calling it diabetes mellitus? Anybody knows? Is there another diabetes? Exactly. Are you a doctor? Very good. So diabetes insipidus is also another diabetes, because remember, the word leakage is still diabetes, whereas in diabetes insipidus, we have a problem with the pituitary gland, or after a head trauma, we have a hormone which, this hormone we call antidiuretic hormone, which controls thirst, right? Or it has a technical name called vasopressin. तो अगर किसी के सर पे चोट लगे मोटरसाइकिल पे, वो बगैर हेलमेट के जा रहा हो, जैसे कल मैंने बहुत से लोगों को देखा, तो कभी कभी उसकी मैनिफेस्टेशन ये होती है कि दे स्टार्ट टू डेवलप दिस लीकेज ड्यू टू डिस्ट्रक्शन ऑफ दिस मैकेनिज्म, कि जो वेजोप्रेसिन सिक्रीटिंग सेल्स हैं वो तबाह हो जाते हैं, और दे कैन नॉट स्टॉप ड्रिंकिंग एंड पीइंग. So it's like a dog trying to chase its tail. So that's what we call diabetes insipidus. अब इस मौके पे I will invite you to forget it. So you completely forget I ever said that, right? I don't want to complicate. Next slide. Now, this is the key statement here. So I've written it in English, right? And what does it read? What is the most important thing for a physician or a healthcare provider to do when they're encountered with a patient of diabetes? अब आप सब लोग जो हैं, in some way or the other, you have encountered people with diabetes, right? So आपकी राय में, why do the patient have to come to you when they have diabetes? Where are the doctors? Any physician colleagues? What can you offer them or yourself? Why do they need to come to you? Because in this day and age, everybody's auntie, uncle, somebody has diabetes, somebody has a glucometer, so they measure and they see the sugar is high, so they already know they have diabetes, right? So when they come to you, what is one single thing that they come looking for? Cure? Can you cure diabetes? You'll be a billionaire. Huh? For good control. So management. They come to you for management, but they can look up on the internet. There is WhatsApp messages that you have Karela, or you have some disgusting stuff to eat which can cure diabetes, and their auntie can manage them for them, right? I know that you can give them a structured management. लेकिन वो जो आम लोग गाँव में हैं या इधर उधर हैं, वो जब इस हॉस्पिटल में आए and they met you, the physician, what is the single thing that you can give, the USP of the doctor or healthcare provider? What can you give them? What do you offer them that nobody does? Insulin, desirable results, assessment of complications, management, understanding of diabetes. Okay, next slide. Huh? Lifestyle changes. Next slide. Make a diagnosis, right? Always remember that diabetes is about 50 different diseases, right? So if somebody comes to you with anemia, you wouldn't start treating the anemia. You will find out whether it's iron deficiency, B12, folate, bleeding, hemorrhage, this, that, thalassemia. You will then treat the anemia. So the diabetes traditionally, for years and years and years, have been diagnosed with raised sugar. So anybody who's got raised sugar, we say have diabetes. So the diagnosis is already established and somebody has already given them some advice, blah, 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 blah. But when they come to you, you as healthcare providers, from now on, remember, like if somebody has renal failure, their urea is very high, you wouldn't start somehow trying to extract urea. You will make a diagnosis. The diagnosis is made by taking the history and doing some appropriate tests, and then you will reach the diagnosis as to why they have diabetes. 50 different diseases, remember? Okay, next please. So what is diabetes? Next. If you have these 50 different diseases, right, you have to lump them into two areas, not categories, two areas. One of the area we call type 1. In the past, we used to call it insulin dependent, which created a ridiculous situation that half of the non-insulin dependent diabetics were also on insulin, right? So type 1 or type 2, this is where we will focus our talk on. So remember 50 different diseases, some of them will fall into this category. This is about 5% of the diabetics, which we now call type 1 diabetes, because the understanding of disease has evolved. So in type 1 diabetes, what happens that the body's immune system, due to usually a virus, a preceding virus, if you take a history, they'll say, oh, my kid has a cold or he had some bug and then subsequently started to develop this diabetes. The immune system works by making antibodies, right, to fight the virus. So the antibodies misfire in a host of conditions, which we call autoimmune, like the body is trying to hurt itself through its immunity. And in this type 1 diabetes, you can see that the pancreas, which has these so-called beta cells, which make insulin, come under attack from 3 different antibodies. And these 3 different antibodies, as you can see, are to the islet cell, the cell from where the insulin is being produced, please, to this anti-insulin antibodies. And please remember, even if my head is in the way, this glutamic acid decarboxylase, the GAD antibody, GAD. GAD antibody is located on the surface of the islet cell. Okay? So when somebody develops type 1 diabetes and this attack takes place, the titers or the levels of anti-insulin antibody and islet cell antibody decline as the job is done and the islet is destroyed. But the GAD antibodies remain positive in almost 99% of the people throughout life. So if you have a confusion about the diagnosis, because some people are a bit confusing, you can in the lab check the GAD antibodies, right? Now, pancreas is unique in the body as a gland. Can anybody tell me why it is unique? The pancreas. It does something that no other gland does. It is controlling hormones, which means, you see, you like this talk because you are a part of this talk, right? Is that good? Okay. It's a master gland? You sure? So it's a gland which is second round of applause. Because this is the only gland in the body which is at the same time exocrine and endocrine. What is the difference between exocrine and endocrine glands? Duct, the tube. So exocrine glands have tubes. Like the parotid gland has tubes, make saliva. When the food, you see biryani in front of you, and they suddenly fill your mouth. If somebody upsets you, especially the ladies, the lacrimal gland is conveniently situated here, so they can cry like this at the tip of a hat, ice, tears, right? Through the tube. So the tube makes it simple but unidirectional or functional. That gland उसका एक ही काम है, बस उसने जो बनाना है वो अपनी साइट ऑफ एक्शन पे ट्यूब से डिलीवर कर देगा. जो endocrine glands are on the other hand, they are ductless, they have no tube. So what they make goes into the bloodstream. And when the blood goes everywhere in the body, they work in everywhere in the body through what we call receptors. So they have receptors, ताले और कुंजी वाली बात है, राइट, लॉक एंड की. तो उनकी कई जगह पे लॉक्स हैं जो वो खोल देते हैं. तो pancreas is one of those unique glands in the body which is exocrine and endocrine at the same time. Exocrine function takes the bulk of it, so it makes enzymes for digestion. What are those three enzymes? They are the endocrine functions. Amylase, lipase, and protease. So amylase for carbs, lipase for fat, and protease for protein digestion. It'll put straight into the gut, right, through a tube. So this is the mechanism of type 1 diabetes, okay? So remember, the diagnosis of diabetes is not made by the level of sugar. That's for the aunties and uncles and the patients to make. But when they encounter you, the diagnosis is made on what the insulin is doing, because it's a problem with the insulin. So here, the indigenous insulin has dropped. So you can measure it. How do you measure insulin in the body? God has made a system that there's a little tiny bit attached to the protein which comes from the pancreas. Huh? C-peptide, you want to say. C-peptide is a little thing which is cleaved off the insulin. So you can check in the blood the level of C-peptide, the 4 antibodies, and your diagnosis is in front of you. Because the C-peptide will go down as the indigenous production of insulin goes down, okay? And when the characteristic defect arises here, it is depletion of insulin. So they have quantitative reduction in insulin. So insulin is not in the body. So what will happen consequently is that it will have no control of sugar. Sugar will start, welcome, please. So the sugar will then start to leak, diabetes mellitus. Remember the leakage of honey? That sugar will try to leak from the kidney so it cannot harm the body. Now remember this, because this principle will become very useful when we discuss its management. Always the management of a disease must be aligned with how body tries to deal with it, right? So this glycosuria, lot of sugar will leave. And because sugar is a heavy osmolar weight substance, it'll suck water, so you will get what we call polyuria, lots of urine, right? This lots of urine will continue unabated in the night. So the most important question you will ask is, do you wake up in the night to go to the loo? Because if it wakes you up, it means it's real. Otherwise, some people, cruelly mentioning again, some predominantly ladies can develop what we call hysterical polyuria, polydipsia. So they keep drinking and keep peeing in the day, but in the night they sleep, right? So nocturia, polyuria will create the first symptoms of type 1 diabetes. And because 80% of the body is made from water, you will have a profound weight loss. right? And with that, there are 6 hormones which will notice that the body's milieu has gone haywire. They will all come out. 6 hormones, which are the enemies of insulin. So remember, insulin is a protective hormone. It's like the mommy in the house. When the kids have played, everything is gone here and there. She puts everything back together. That's insulin. And those rowdy kids, 6 of them, they oppose insulin. So they will come and destroy everything. Can anybody name those 6 hormones? Excellent. One is glucagon. Hmm? Just feel free, it's a discussion. Growth hormone, glucagon growth hormone. So adrenaline, noradrenaline, dopamine, glucagon, growth hormone, and the most destructive, like a pulsation in the house, a huge big dog, corticosteroids, the cortisol, they will all climb because they will sense their opportunity that Amma has left the house. So they come and they start to destroy the body. So you get what we call catabolic consequences of type 1 diabetes. You will find no muscle on them. They will be weak. They will be able to comb their hair. They will be climb the stairs. They will visibly become very sick because of these 6 animals which are high. Okay? So you got the osmolar symptoms of nocturia, polyuria, thirst when you have no water, weight loss, and then you have what we call immunoparesis, that your immune system will become blunted. So they will start to get boils and abscesses because the Staph aureus sitting on the skin. When he eats sugar, he'll make big, like they might present to you with an abscess and a boil, etc. So type 1 diabetes and its consequences, you get it, right? And its diagnosis is here, glutamic acid decarboxylase. So once you made it, you cannot treat them with anything except insulin. Say it please again. Right, because if you don't treat them with insulin, what will happen? Quickly, because we have people with very precious time to spare. Yes, yes, the most sinister thing which will happen is that the body, when it senses it cannot gain any energy from sugar due to the absence of insulin, will switch to fat for its metabolism. And fat, when it creates its metabolic thing, it goes into so-called Krebs cycle, from where it creates the energy packets, which is called ATP. But there is a byproduct of that, which is called hydroxybutyric acid, and that then creates lowering of the pH of the body, which is called ketoacidosis. And that ketoacidosis, if it lowers below a certain point, will consume all the buffer of bicarbonate, and the person's cerebral level of consciousness and cardiac level will all decline, and the person will go into a coma, the DKA. So never ever hesitate to start insulin immediately once you have get antibody positive, C-peptide is low, osmolar symptoms, destructive symptoms are there, and you give them insulin, okay? Any insulin, but some insulin, okay? So once you start to give insulin, they will rapidly begin to repair themselves. Everybody clear? Okay. Now, just to illustrate my point, that diabetes is about 50 different diseases, right? So diagnosis is the key. This is what we call the monogenic diabetes, where there's a defect in a gene. So these are inherited. You can get in your history a whole family tree. Son, the dad, the uncle, the auntie, the neighbor, everybody has it. You can create the whole family history, right? So this one, monogenic diabetes, is the defect in the chromosomes. So it cannot create enough insulin. So this is a secretory defect. So here, which will be the treatment of the choice? Sulfonylureas. Only situation in diabetes, remember, is this where sulfonylureas can be employed. Otherwise, they are very dangerous drugs, which I will show you subsequently in this talk. That's the key of success of a physician to make the right diagnosis. Okay, next slide, please. And then you can see here, if the entire pancreas is destroyed from disease, right? Exocrine as well endocrine. Alcoholism in UK, where I come from, gallstones here. So the entire pancreas is destroyed, exo as well as endo. So you have what kind of diabetes? Thank you. You have type 1 diabetes, but not with GAD antibodies, right? So here you not only have to replace insulin, you also have to replace other enzymes. Creon, which is amylase, lipase, and protease, packets, little capsules, okay? Next slide, please. So this goes on. These are the benign tumors of all of those evil 6 hormones, remember? The cortisol that you mentioned and all these. So if somebody has these conditions, which you can take this slide, I'll leave it here, all this presentation, so you guys can kind of remember me from this, okay? So if you have this, you can achieve something unique. That's why I keep saying diagnosis, diagnosis. What can you achieve in these diabetes? You can cure them. You know, diabetes at the moment is not curable, but there you remove their tumor and diabetes goes. So it's a chance to cure the diabetes. Again, drugs, the glucocorticoids, thiazide, diuretics we commonly use. Keep going, keep going. Then diabetes, keep going. So the diabetes specialist is not a person who just start to dish out treatment. He needs to first make this diagnosis and then tailor the plan accordingly. Okay, please, next slide. Now, we have what time now? We have 20 minutes? Okay. Guys, we have 20 minutes. I want you to focus on the next 10 minutes, please, because this is where, as we say in England, the cookie crumbles. What's happening here? Can anybody see and everybody see? There is a huge, that's why I was saying to the great leadership you have yesterday, there's a huge increase in diabetes, but it's not the one that the Greeks described 1500 years BC. This is a new kid on the block, the so-called type 2 diabetes, which we will now discuss for 10-15 minutes. You can see that in every part of the world, there is 100+% increase in it, including here, right? So this is a much bigger epidemic than the COVID. There's more people with this than COVID. There's more people who die from this than COVID. But look at the resources put into COVID. And look, nobody does anything about this epidemic. Okay, please, next slide. So this is me. Well, it's not really me, but somebody in our generation going to school, okay, maybe 30, 40 years ago. What are the things you can pick out from this picture? You see, you guys have been, I have to say, tremendous audience, really, tremendous, because you are fearless. So point out to me some things here. He's got a bicycle, which we all had, okay? And what else? He's slim and smart. The slimness and smartness is not the presence of fat, it's the presence of aerobic capacity. Fullness and smartness is that how many times you can sit up and stand up, sit down. Murga jo nahi bante the. How long can you be the murga is the core strength of the body. So this kid is going to school on his bike and there is no road. He has to turn the bike, move the bike, up the bike, down the bike. And look how, as you pointed out, he's slim and smart. Okay, next slide. Now, in current climate, you will say this is a really weak man and needs a good biryani, right? But look, he has plowed the entire field and he hasn't got an ounce of fat on him, right? He's got endless energy. Next slide, please. And this picture makes me sick, really, because if you think about it, do you know who these people are? Construction workers. Which construction workers? These are the Irish people who built New York, the big tall buildings. So you can see they're all having their lunch break, sitting on this miraculously and nauseatingly high steel thing, right? And they're all having their lunch. And look, none of them have an ounce of fat on them because they are working, okay? Next slide, please. And these are an Indian band which comes to Kuwait, where I spent some of my life. And you can see they're all happy and like really, really cheerful. But what happens when you bring that kid of the bicycle, the Kisan from the field, and these rock stars into a place like Kuwait or Pakistan? Next slide. This is just an illustration that look, this is sugar, pure sugar, sucrose. You have for 3 weeks, you increase it to these. What happens? Next slide. You can see the liver ALT, which is a very sensitive of fat in the liver, goes straight up, and so the fat content of it does. The liver is attacked by the sugar. Okay, next. So please keep pressing. Keep pressing. This is what happened, right? We were here, and now we are there. So unfortunately, in the Industrial Revolution, we had two problems. We kept fixated with the food that we were eating preceding it. जैसे हमारे forefathers used to have desi ghee. Oil is a very good food. It's a it's a quirkiness of English language that fat is synonymous with being overweight. But fat is an excellent food. It doesn't make anybody fat, right? But our parents and their parents knew that. So they were fat heavy. So our food became carbohydrate heavy. Rice, bread, pasta, and potatoes. And the most important thing this guy is doing is what? Sitting. So inactivity. Inactivity means that you don't move. Like the bigger the boss, the lesser the movement. So the CEO will, not the present company excluded, will call the person like this and say out or in. So only his finger is moving, right? The rest of the body is not moving. Like in Kuwait, we have this bizarre situation that all the wealthy people are my patients because of this. And they all come with their maids. None of them have diabetes because they all work. So they falsely believe that they are healthy and they're, like it's an upside down situation. So we stopped working. What by that I mean consumption of energy. So cleaning the car, going up and down the stairs, the reluctance of going up and down the stairs, and cutting the grass, hoovering the house. All of these things are life-saving activities, but we don't indulge, and we have the same food which is coming from the past. You get the picture? Next slide. Now, in this very interesting slide, you guys can see how this works. Because honestly, you will swear, Wallah al-Azim, I don't even eat anything, and I've become fat. Especially women. I just breathe air and I become fat. Why happening? Why is it happening to me? This girl eats a whole tub of biryani and she's thin. What's wrong with me? But what's wrong with you is this. You can see how if you are sitting and listening to this lecture, you burn 30 calories. Giving lecture 70. अगर आप ऑनलाइन ऑफ चीज़ें मंगा लेंगे पिज्ज़ा और अब घर में पकाएंगे तो उसकी वो 150 कैलोरीज खर्च होंगी. और अगर आप किसी और से सफाई करवाएंगे, मासी, जिसका मतलब मासी है, आई फील, मासी बेचारी जब सफाई करेगी वो तो हेल्थी रहेगी, लेकिन आपकी जो है वो तबीयत दूसरी तरफ चली जाएगी, राइट? So this is a very simple illustration of how we have let go of simple rules of movement, right? And stacking ourselves with pizzas and all of these things. Next slide, please. अब ये जो यहाँ पे ख़वातीन मौजूद हैं उनके लिए आप ये देखें कि ये एक 24 आवर कैलोरी काउंटर है. ये एक बेसल लेवल पे एनर्जी कंजम्पशन चल रही है. When you get the kids ready for school, जैसे वो वन डे इंटरनेशनल में सिक्सेस चलते हैं, सिक्सेस देखें कितनी मेहनत करते हैं माँ बाप स्कूल भेजने के लिए. Same as doing weight training, right? Sitting and driving, nothing. Standing, or if somebody annoys you and you're pacing up and down in the office, you can see how you increase your energy consumption. So please remember, when you get the opportunity, go up and down the stairs or move, just move. It's not about exercise. That's a different thing to movement, because movement keeps the muscle receptors open for sugar. Otherwise, they shut. And then the only place it can go is the fat. Next slide, please. Here. Now, this is a guy, stay there. Next slide. You see very interesting phenomenon. This happens to men. Next one. We have our college waist at 36, right? And as this excess energy is into us and our activity has declined, we start to store fat. Now remember, there is nothing wrong with fat, but its location, right? So God made fat to go under the skin, subcutaneous fat, which will cushion us, warm us, right? Shazar won't have to wear so many layers, right? So it'll warm us, it'll give us this kind of inherent warmth, structure of the body, shape of the body. So there's people who do liposuction from under the skin is the wrong place to suck it from, right? It's the fat which then enters the cavity of the body, the big cavity. So due to gravitation, it settles down. And you know, in a big black bin liner, you start to throw rubbish in it, it takes ages to swell up, right? When it starts to swell up, it means there's a lot of fat in the tummy. Okay, so please, next slide. So this is the so-called lowrider syndrome, that we still try to wear the same trousers, but we pull it down a little bit. So we can kind of make ourselves happy that we are the same squash players that we used to be, but unfortunately we become different. And honestly, nobody looks at their own tummy. This is a very bizarre thing I'm going to tell you. Next slide. But when you weigh yourself and he says, who is sitting on me? Somebody's sitting on me. This is surely not my weight, because it just creeps up on you gradually over these months and years. Next slide, please. And here, now, this is a very interesting thing. The doctor is listening with a stethoscope for the heart, but where he should be listening to for this person, where is the risk to his heart, is here, right? So this central adiposity, or the location, abnormal location of the fat, which sometimes is very deceptive, by the way. Next slide. This is the CT scan of two people. You can see that they don't look any different in terms of size, but this is a normal person. So this is his liver, and you know the subcutaneous fat that I said, nicely sitting under his skin. But when the fat infiltrates, look, his girth is almost the same, but his entire liver and his muscles are covered by fat. So he's got a barrier of fat in front of him. Please. Now this is for like a little technical, but remember I was telling you diagnosis. So the problem with this type 2 diabetes is, because it's called diabetes, attention is always focused on the sugar. And you can see here that up to 20 years from its start, the sugar remains normal. So these people already have developed insulin resistance. The insulin, remember type 1 diabetes? There was no insulin, no C-peptide, going down like a crash. Here is the opposite. We have insulin conduit's job. Insulin job is glucose disposal into the muscle, 80%, into the liver, 10% for overnight consumption of like glycogen, and 1 to 2% to the fat. That's the normal GDR, glucose disposal rate. Here, the fat, the muscle is not listening because he is not moved, okay? So the fat will then rapidly go into the liver, and the liver will try to format it like a compressed computer files. So if you do, they will have a lot of fat in their liver. So the ALT, AST will rise, not too much, but there is this degree of inflammation within the liver कि आपके घर में एक दो लोग और आके रहने शुरू हो गए. So there is this irritation, you know. उस irritation को हम कहते हैं non-alcoholic fatty liver disease or non-alcoholic steatoric hepatitis. So it is a hepatitis of low grade. इसके ऊपर अगर आप अल्कोहल चढ़ा दें या Hep A, B, Hep C वगैरह, तो rapidly the liver will deteriorate and fail. So यहाँ से inflammatory marker चलना शुरू हुआ, CRP, blood pressure चलना शुरू हुआ, triglycerides ऊपर चढ़ने शुरू हो गए, और डॉक्टर कामरान का area had already started before the diagnosis, almost a decade. So if you look closely, these people will always have coronary artery disease, right? Because this is a disease of the endothelium. It's not a disease of sugar. In this type 2 diabetes, the sugar is very rarely high, a little bit high, right? So the glycemic toxicity will not manifest till they're 90, and they will be long dead with a heart attack before that. So you got to pick the person with the central girth of more than 40 in men and more than 36 in women. That's the biggest pointer of insulin resistance. The second biggest pointer of insulin resistance is darkening of the skin, which is called acanthosis nigricans. And the third pointer is tags on the skin. Lots of tags will emerge. Why would the tags emerge? Anybody knows? Because remember, insulin is a stimulating hormone. It's a protective mama. Growth hormone also does similar job to some extent. So that is why growth hormone's active metabolite from the liver is called IGF-1, insulin-like growth factor 1, right? Because it looks like insulin. So insulin tries to do its job, right? But the muscle is not listening. So what happens, because the pancreas is not in the attack from the GAD antibodies, will make more insulin. So you measure their insulin and you will find it sky high, C-peptide and insulin levels, okay? So this hyperinsulinemia retains sodium and the blood pressure rises because the volume increases in the body, right? It tries to shift the fat. So the lumpy bits of fat floating around in the bloodstream are called triglycerides. So they are just randomly going around triglycerides. If they go to a critical point, they can make pancreatitis, right? So be careful with them. So this, you need to not diagnose here, you need to diagnose here. Everybody clear? Okay, next slide, please. But when you're diagnosed with diabetes, it's not a wishy-washy disease. It takes 10 years of your life. The moment you're diagnosed, 10 years are down. Okay, please. I just told you about this cardiovascular thing. You can see the other part of damage is the microvessel. So diabetes is damaging the small vessels and the large vessels. Type 1 diabetes goes after the small vessels because it's the glycemic injury, right? So eyes, kidneys, and feet is the target of type 1 diabetes, and heart, brain, and erectile dysfunction, larger blood vessel, is the main target of type 2 diabetes because, keep going, this is the kidney leaking, keep going, because in type 2 diabetes, it is not the sugar alone. It's the collection of obesity, central, insulin resistance, hypertension, dyslipidemia, in which the LDL, or the bad cholesterol. Do you know why LDL is called the bad cholesterol? And HDL a good cholesterol? So there is a lower density lipoprotein and there's a higher density lipoprotein. It's like, think of it like a snowball, LDL. You throw the snowball on the wall, it will like loosely attach, but it's prone to moving from there, right? That's why the plaque can shift and cause obstruction. And heavy density lipoprotein is like a stone. जैसे आप शैतान को कंकरियां मारते हैं, that's HDL. So it will knock off, bounce from the blood vessel wall and come back to the liver because it's like a little ball, heavy density. So that's why you need to lower the LDL cholesterol before the sugar axis is impaired, right? You need to lower their insulin resistance and you need to control their blood pressure. Please. We're coming to the end of this. How much time we left? 12 minutes? Everybody still happy and nobody's sleeping in the back? Okay, good. Because some questions are coming, right? 43%, this is because of the poor management. I'll tell you now. Keep going, keep going. So keep going, keep going. This is scientific mumbo jumbo. which I'll leave for an audience of physicians on another day. Keep going, keep going. Keep going. So basically, what happened was that because we didn't understand type 2 diabetes, the doctors, it's our mistake. We thought there's a problem with insulin, right? Which is not enough, which was the case in type 1 diabetes. So all the treatments were designed to increase insulin somehow. So you have this glibenclamide, gliclazide, sulfonylureas, which were accidentally discovered in World War II because some Dutch soldier got injured and his colleague put this sulfonamide antibiotic on his injury. Remember, we used to have this Septrin and these old-fashioned antibiotics, and he broke out in a huge sweat and his sugar dropped to 1. So he thought this lowers sugar as well. So sulfonylureas accidentally discovered drug, not through research. Okay, so these drugs, they make you fatter, number one, because there's more insulin you're feeding into the syndrome. And secondly, they will cause hypoglycemia because they work 24/7 when you're not eating. So in the sleep, you could die because hypoglycemia happens, heart becomes quicker, and older people, frail people go into VT arrest or something. Okay, so sulfonylureas only in the monogenic diabetes. Remember the MODI where there was the defect of the. Then metformin. Remember glucophage, you call it here, right? We learn from generic names. Metformin is a magical drug. It's cheap as chips, but no drug company could push it away because every research study brought it out on top. So metformin is a very good drug, always use as first line if you have to use the drug, right? And remember that it protects from 5 cancers and Alzheimer's and dementia and all sorts of things that are coming out in its favor. So metformin is a very good drug. I just want to, in these 10 minutes left, talk to 2 things to you about. Somebody get full marks if you can identify this fellow. Yes, it's the Gila monster. It's a huge, big Mexican lizard. And it's not very pretty to look at, right? But it has a unique thing in his spit, in his saliva, that he can hibernate for months without getting hypoglycemia. So he achieves euglycemia throughout the winter. So what extracted from his spit? Exactly. Now, as the colleague said, when we eat, the food goes into the stomach, right? Stomach is like a bag. Every woman carries a bag, the contents of which nobody can predict, right? So stomach is like a bag. You eat, stomach is full. When stomach distends to a critical point, the food begins to trickle into the duodenum. So the duodenum senses that and sends 5 hormones out, which are collectively called incretins. Incretins, there is 2 of them very important. Glucagon-like peptide, because he looks like glucagon, GLP-1 is his name. And there's another one, glucose-dependent insulin peptide, GIP. So remember GLP, GIP. So the drug companies started to develop analogs or something similar to the GLP because in type 2 diabetics, remember that there's huge fat here. So the stomach is compressed into a tube. So the stomach doesn't know when it has distended. So these people eat very rapidly without chewing and go straight into the duodenum and further. So there's no time for the incretins to come out. So their native GLP-1 is very low. And whatever comes out is immediately destroyed by an enzyme called DPP4. So the first drugs focused on this DPP4 enzyme, which was blocked by a drug called sitagliptin, lanagliptin, right? These drugs only work at the beginning of the disease when there is still enough GLP-1 present. So as time goes by, it declines. So the history, as you pointed out, of the GL1 extraction is that the first one was very impure, and it was exenatide, Byetta, which made people really sick as a parrot. You give them a vomit. So they lost some weight, but then the question was, is they losing weight because they can't stop vomiting, or they're losing weight because of this medicine, right? So the drug company refined it and made liraglutide. which is called Victoza, which is a better drug once a day. And I think you have it in this country. But then it moved further on and they put a small fatty chain. Again, another lecture for the doctor colleagues. They put juxtaposition to amino acids and inserted a fatty chain. Life became prolonged of the GLP, and they call it dulaglutide or Trulicity. And another one called semaglutide Ozempic, which we use a lot in the UK now, because these drugs reverse the entire syndrome rather than, remember, just lip service of sugar control, the person getting fatter and fatter. So they start to lose weight, the blood pressure, the dyslipidemia, and the entire syndrome begins to turn around. And now we have a latest one. Inshallah, when I come again, I'll do a talk on these. The latest one is called tirzepatide, which is Mounjaro commercially. It blocks GLP and GIP simultaneously. So you can lose weight more than bariatric surgery. All the ladies make note of the name Mounjaro, right? And just lose weight like this. So it's a very good drug, please. So this paradigm shift, GLP-1, this is the one paradigm shift. Now we want to have our clinic jointly with the cardiologist because we know we have our house in order. Before, we will put everybody in serious complications and then hand them over to Kamran. Can you please fix it? So it's our problem, the endocrine problem, which has been resolved due to the GLP-1, okay? The second paradigm shift, next slide, please, briefly touching, is this drug, which is called SGLT2 inhibitors. These are very, very good drugs, like amazing drugs, right? Why? Can anybody tell me why?
Because they not only remove the glucose independently of insulin from the kidneys, they also cause weight loss. They are cardioprotective.
Indeed, but what they do is to mimic or align with normal physiology. Remember, the body dealt with hyperglycemia in Egyptian time by making glycosuria. So this is what they do as well. So they actually follow what the body is trying to do. So you lose the glucose from the urine, and it's not dependent on what insulin is in your body. So this is where their risk also lies. And what's the risk, sir?
Because more glucose in the urine, then there are chances of urine infection.
You can get obviously an infection because you need to wash properly, okay? But there is a very serious risk that I want you all to remember.
Hyponatremia.
Yes, they can cause a DKA, which is called euglycemic DKA, in which the sugar is normal. Remember the ketoacidosis that you mentioned? Traditionally, because of type 1 diabetes, the sugar was always high. But in certain conditions, alcoholics, poor people not eat properly, and pregnancy. Remember, if anybody of you connected to pregnancy with type 1 diabetes or any pregnant diabetic, remember that these drugs should not be given to them because they are working, as you said, independent of insulin. So even if there is no insulin in your body, they will spuriously bring the sugar out and you will feel the person is okay. And there's suddenly, we have had this 2 deaths in our hospital in UK, pregnant women, because we could not, this is what we call starvation ketoacidosis. So you have to actually give them dextrose infusion and rapidly the process will reverse. Pregnant, make note, okay? So euglycemic ketoacidosis is their only big problem which one needs to be aware of. Other than, as you said quite rightly, they are drugs for the heart. Now, my cardiology colleagues in the UK, I work very closely with them. We use them in heart failure without diabetes because they have some magical effect on the heart muscle. They wake up the dead heart muscle. There is many theories about that, which is another talk that I will inshallah do. So these drugs are very good drugs for the heart failure. They reduce the volume load, they regenerate the myocardium, they create this ATP Krebs cycle again, the cells start to come alive, etc., etc. So they are very, very good drug for cardiac functions. Okay, next slide, please. So when you're everybody in the world, especially in Pakistan, people think that if they eat sugar, they will develop diabetes. Nobody in the world, there's nobody who doesn't eat sugar, right? So it's not about eating sugar, it's about handling sugar, right? So everybody can eat sugar, but if you eat too much, you'll become fat. The fat will go in the middle, and all the spiel that I just described will happen. Please. So just to briefly show you, there is many things which can reverse type 2 diabetes other than the GLP-1, the Monjaro, remember, or Ozempic. There are many other things. All these studies you can see better than metformin in losing the sugar load and the weight. Please. This is, you see, there is a counterpoint study in UK. In my country, they put a draconian diet of 600 calories on people who develop type 2 diabetes. 600 calories is nothing really. 2 salads and a glass of milk. So you can see how you lose weight in 6 to 8 weeks in the next slide, and how you lose diabetes. It's very simple. जैसे हमारे यहाँ मोटरसाइकिल में वो नहीं कहते पाकिस्तान में कचरा फंस गया. That kachra is in the pancreas and the liver. You get the kachra out and they start to perform much better again. Okay? So don't think of it as a drug heavy thing. You have to teach them about the lifestyle change. Lifestyle change का मतलब ये नहीं है कि आप उन्हें कहें कि आप कल से मैराथन भागनी शुरू कर दें. You have to just say to them that change your life permanently, and you need to walk 30 minutes a day. This is all evidence based that I'm saying. 30 minutes a day for 5 days, brisk walk where your सांस फूली, आपकी सांस फूले, but you can still talk, the talk test we call it. 30 मिनट की वॉक 5 दिन हफ्ते में, and next
150 minutes
in a week, accumulative, right? So this is the metformin magical drug we already talked, and then we come to this last 2 slides. Please remember, this is so many trials of antihypertensives, right? In diabetic people, because of the stiffening of the blood vessels, their blood pressure is very difficult to control. And remember that the blood pressure is the single most lethal killer of people. If you go to UK, in the wards, 90% of patients are women. 100-year-old, 105, they're all admitted. There is not one man, because they're all dead, right? before before they before they can claim the insurance the poor people have paid for all their lives, they're smoking away with the central fat, and are dead. Whereas women are very, very organized people, but they also don't have hypertension, right? So the lack of hypertension makes them invincible. What is going to kill them finally? I don't know, right? Forgive me, this is this is all in jest, right? But this is a fact that if there were no women, there was a study in UK, if there were no women, like single men or men who've been separated, their risk of dying is many-fold more than if they were with a woman.